Good afternoon, dear professors. Thank you for the opportunity to participate in this great event. My name is Samir Cubas, and I am a senior resident in the vascular surgery in Lima, Peru. Today I will be present about our job with the title acute lower limb arterial thrombosis in the COVID-19 infected patients experienced in the National Hospital in Peru. The most frequent clinical presentation of COVID-19 is asymptomatic in the 85% of cases. It has been associated with thromboembolic disorders in the 50% of cases. Only 6% are arterial involvement. Of these, 80 to 1% involve the lower limbs with a designation acute lower limb arterial thrombosis with a acronym ALAP. Many studies around the world in the map, in the red points in the image, have shown alarming morbidity and mortality data and arterial ischemic manifestation throughout the body. However, we have evaluation of their survival and outcomes to go with us our objectives. There are three important published studies that include Peru, some countries from Ibero-Latin America, and the third with the recent SBA's clinical practice guideline reported hospital mortality of the 22% to 32%, but nothing on follow-up survival outcomes in the short long term. Our study was discrete observational and retrospective study. We evaluate patients infected with a COVID-19 with a lot from March 20 to February 22 in the Edgardo Rebagliati Martins National Hospital, located in Lima, Peru. Electronic medical records were reviewed. Patients with a history of AF, PDA, smoking, previous vascular surgery, and coagulation disorders were excluded. About the variables were baseline, laboratory, clinical, surgical, and short-term outcomes, less than or equal to 3 days. About the results, the main age was 68 years, and they were mainly male with a 61%. The main comorbidities were diabetes, hypertension in more than 50% of the patients. COVID, 25% were severe cases, 34% had a correct lung tomographic score of 5. That is a severe pulmonary compromise of more than 85%. At that time, to treatment was 11 hours. Rutherford score was mainly to be 3. The most frequent location was the femoral popliteal and infrapopliteal segment in the 68% of the cases. 60% received thromboembolectomy, more than 50% underwent amputation, especially minor amputation. Laboratory findings show serious alteration with DD merging, CRP, fibrinogen, ferritin, INR, and in APTT. In this image, the main arterial segment affected was the infrapopliteal, especially the anterior tibial artery with a 39%. In the right, imagine on the right, minor amputation were the most frequent, especially the metacarpal disarticulation in the 69%. Okay, in the Kaplan Meier analysis on the short-term follow-up showed 46 survival, 53% mortality, mainly related to respiratory distress, septic shock, and the massive thromboembolic events in the 3 days in follow-up. Okay, finally, the physiopathology clinical course of the classical lab versus a lab COVID-19 are totally different. leading to worse outcomes, such as amputation despite embolectomy and full articulation. We report high 3-day mortality. It has been shown that ALAT can occur in the symptomatic COVID-19, and if the only clinical manifestation of infections. The main artery affecting the ALAT was the anterior tibial artery. I hypothesis the presence of more thrombogenic viral variants with age weight, I don't know. However, we need more sure long-term follow-up study because COVID has not yet been fully deciphered. Thank you very much.
Okay, we don't have enough time for questions. I think we need to move this.